Hi, this is Dr. Manjiri. I'm at sifi.com.
As an expert, what are your guidelines to achieve the look good and feel good aspiration?
As an obesity consultant and cosmetic physician, in these last 2 decades which I'm practicing, I come across almost hundreds of patients who are confused about their lives. They are so bothered about their certain areas of their body, they don't like them, they are so concerned about their appearances, and somewhere it is affecting their self-esteem and their inner confidence. Your external appearance is very important in all areas of life. You are constantly being judged by people by how you look, and your self-image is what you are perceived by others. So it is very important for yourself how your attitude develops towards you. You have to have that, that perfectly sculpted body, great skin, good hair, so that your external transformation happens, and along with that an internal transformation also happens. As we say, your body starts improving, your everything, your mind, your soul and everything is a complete transformation. You start feeling good about yourself. See, everything, we all have it in us, but it is about developing this physical skills along with certain social skills. And this goes a long way in your excellence. This excellence is everywhere. You go for an interview, you look good. Yes, of course, it is about having that skill, about that expertise and knowledge, but yes, you get a little edge over others. You appear more confident, and then you are ready to face the world. It is about how you feel about yourself and how you are perceived by others, for which your external appearance, your good looks are very important.
How do you explain the difference between being overweight and being obese?
Being overweight is about weight. Now, when we talk of weight, it is the weight of your fat, it is the weight of your muscles, it is about the weight of the water, the entire body. But when we talk of obesity, it means only fat percentage. WHO has defined obesity as excess of body fat rather than weight. When we say obesity, men with more than 25% of the body fat and women with more than 35% of the body fat are considered as obese. Now, we have certain criteria to decide about who is obese, who is not obese. For that, is popularly we check it with some concept called as BMI, which is a body mass index. Basically, it is a ratio of weight in kilograms divided by your height in meter square. So when you, let's say in Asians, your BMI up to 25, 18 to 25 is considered as normal. 25 to 30 is called as obese, and after 30 it starts giving you complications. There are certain other criteria which are very simple, and you can do it at home also to understand whether you're obese or not. They are like waist circumference or waist to hip ratio. In women, if your circumference is more than 35 inches, and in men, if it is more than 40 inches, you are considered as obese. Also, your skin fold thickness, if it is if you can hold your skin and if there's fat underneath, then you know that this is an obese part of your body. So generally, it is obesity is about percentage of body fat.
How does being obese or overweight affect one's health?
Well, obesity is, it used to be considered as just a problem. It's like a social or a cosmetic problem where people will call you, oh, you're obese, and you don't want to be called like that and you look fat. But today, WHO has specifically now given the nomenclature of disease to obesity, and it is called as globesity. It has become a pandemic disease, and now all over the world there are more deaths which are caused by obesity than any other illness, which is like AIDS or something. Now, obesity affects all the parts of the body, right from your central nervous system, your respiratory system, your cardiac health, everywhere. Obesity, as in increase in the fat percentage, it causes increase in the coronary heart disease. You have increased chance of stroke, blood pressure, your chance of having diabetes are more. Especially in women, obesity and depression is extremely correlated. It is yet to be seen whether depression causes obesity and overeating, or obesity causes that low self-esteem and then they go into depression. Well, it is all interconnected. All areas. Obesity predisposes you to increased rate of tumors, cancers, on the skin, it causes cellulite, and also because of stretch marks. After pregnancy and delivery, you get a lot of stretch marks. Lot of pulmonary complications happen, that is, people are not able to breathe at night because because of the fat which pushes their lungs up. So on the whole, I can say that obesity increases your risk by about 15 to 20% having the other diseases which are related to obesity.
What is your take on one of the most popular trends today of going under the knife to get that perfect body shape?
Yeah, I think cosmetic surgery is a very popular method these days. It is popularized by all our film stars that, they just make a trip somewhere and then they undergo the knife and they come back. But well, as we say, any surgery has its own risks. Whenever you decide to go into an operation theatre, there are risks of surgery and anesthesia. Well, there is a risk of anesthesia, which is great. There's a risk of surgery, be it a small surgery, like, you're doing a nose job, or you're doing obesity surgery like liposuction, when there are liters of fat are being sucked out, all in a matter of 1.5 to 2 hours. So it is a risk of surgery, risk of anesthesia, and the risk of, the fat being sucked out, or when we are messing up with body's own physiology. Plus, it's not as simple as it appears. You have to get hospitalized. There is a post-op care, and then there are complications like, the fat going into your bloodstream and going into the heart, which I think very often we hear of these cases, incidental cause of death is liposuction happening to so and so film star. Well, these risks are always there. It appears very magical that, I go into the operation theatre and I come out looking slimmer and trimmer. Well, it doesn't happen like that. You have a lot of risks involved in that, and there's a complication. And also, again, I would say it is not permanent. Suppose you are undergoing a liposuction, that is, you are taking out the fat on the abdomen, but what happens to your total fat percentage? Does it go down? No, because ultimately obesity is about reducing your fat percentage so that the other complications reduce. Your complication, your rate of, your incidence of other risks also always remain the same. And what happens to the fat which is not yet sucked out in other areas? Well, it remains the same. So I would say yes, it is good for people who don't have much time and want to look good immediately, but it comes with its own risks.
What according to you is more important, weight loss or fat loss, and why?
I think both are important, I would say, but when we are talking of weight loss, well, today, if you see the practices, people talk of weight loss and they talk of things like, lose 1 kg in a day. Well, that's not weight loss. People are talking about water loss, which is extremely dangerous. I would say that if you have to choose between the two, fat loss is a much healthier option, because ultimately we don't want to lose muscles, we don't want to lose water. What we don't want in excess is fat. So it is always better to have a fat loss. Now, we have always seen that everybody has a genetic predisposition for a fat deposition. Like in women, you will see that it is around hips, thighs and abdomen, and in men it's mostly around your waistline. And that is an area which probably just doesn't go with diet and exercise. So that is an area where we should be reducing the fat from. If your fat percentage comes somewhere between, let's say, 20 to 25, and then your BMI also comes down, and then you are in a healthy range. So it is better to go for a fat loss than just aiming at a weight loss, which could mean also muscle loss or water loss, which could be undesirable in the end.